When you send your cast to the lab to have a custom tray fabricated, you should outline where you want the tray to end. When you're looking in the vestibule, you want the tray to end about 2 to 3 millimeters from where the height of the vestibule is. So if you look over here, we've got a horizontal portion that represents the vestibule. We want the tray to end on the vertical portion of the ridge and to be a couple of millimeters above that. So we're going to draw our line in the vestibule a couple of millimeters short to allow for room for the compound. The exception is on the posterior border. We're going to take the tray right to the posterior paddle seal. We don't want to stop short of that area, otherwise it will be difficult to get the compound extended back that far. So in the buccal vestibule, again, 2 to 3 millimeters short, should not be on the horizontal portion of the vestibular height. It should be on the vertical surface. You don't want it too far away from the tissue, and you also want to make sure that you give some room where there are frenal attachments in the area. In particular, in the labial frenum, it's important to make sure we go all the way up and around to provide enough relief for that frenum so that the very top of the frenum is not compressed by the tray or eventually by the denture. Again, on the opposite side, 2 to 3 millimeters shy of the height of the vestibule. And again, following the contour of the vestibule as long as the vestibule is not distorted. So that's what the outline of our custom tray would look like in the maxilla. In the mandible, we follow a similar procedure. Here we've got an extension that's quite a bit broader into the buccal vestibule. So we want to make sure that we don't extend too far. Again, we want to stay a little bit shy, and we want to stay on that vertical portion. We don't want our tray getting way out here into the vestibule per se, or into the cheek, or covering the external oblique ridge. So again, in this particular case, staying on the vertical portion, not much of a labial frenum on this particular case. And again, on this side, we're going to stay on the vertical portion of the ridge, several millimeters shy at the vestibule. Don't get on the horizontal portion of the vestibular roll. If you do make an error, you're better off making the tray a little bit longer rather than a little bit shorter. It's easier to grind off excess tray rather than try to add compound that's very, very short of where your vestibular height is. Here's our retromolar pad in this area here. We need to make sure that we've at least caught part of that retromolar pad, and we need to make sure that, again, we're a little bit shy of the lingual vestibule. Remember that the tray should not come back from the retromolar pad. It should either come straight down and forward or should angle slightly forward. It will depend on the shape of the lateral throat form for your particular patient. Again, on this side over here, make sure we go up and cover part of the retromolar pad, and then coming down, and again, a little bit short of the depth of the vestibule. In this particular case, there's not a real prominent lingual frenum. In some cases, you may find that you have to move that up to provide relief for the frenum.